Welcome back to Have More Babies. I'm so glad you're joining us today. As parents, we're always trying to figure things out, right? Trying to get that key bit of info that helps our kids really thrive. Today, we're getting into something that might seem simple at first, but it's actually pretty complex and super important for your child's health. Enlarged adenoids. We're basing our chat on this really great article from Omega Pediatrics. It's, focused on giving parents clear, actionable stuff. Okay, so let's dig in. What exactly are adenoids and, why should we care about them?
Yeah, it's a great question because honestly, a lot of parents haven't heard much about adenoids until they actually cause a problem. So picture this. They're these soft, sort of land-like tissues, way up high in the back of the throat, kind of behind the nose where the nasal passages meet the throat. They're part of a bigger group of tissues, including the tonsils and sometimes called Waldeyer's ring. And their main job, they're part of the immune system, a really important part, actually.
Okay, immune system, like
Yeah.
the tonsils then.
Exactly. Similar role. They act like gatekeepers or sentinels. They sample bacteria and viruses coming in through the nose and mouth. They're packed with immune cells, lymphocytes, and they're basically an early warning system designed to trigger an immune response when needed.
Yeah, it's a clear picture. Little immune guards at the gate. So, if they're doing such an important job, why do they sometimes cause trouble? Why do they get enlarged?
Right, that's the million-dollar question. It seems counterintuitive, doesn't it? They're there to fight infections, but fighting infections can actually make them bigger. The Omega Pediatrics article points to three main reasons this happens. First off, and probably the most common, is just frequent infections.
Sounds like colds and stuff.
Exactly. Every time your child gets a cold, a sinus infection, any respiratory bug, the adenoids jump into action and they get inflamed, they swell up. But here's the thing. Sometimes, especially after repeated infections, they don't shrink all the way back down. So each infection can leave them a little bit bigger than before. It's sort of a cumulative effect over time.
Ah, okay. So it builds up. That makes sense. What else contributes?
Well, the second big factor is allergic reactions. If a child has allergies, maybe seasonal allergies or allergies to dust mites, pet dander, that kind of thing, that chronic inflammation in the nose and sinuses can keep the adenoids irritated and swollen too. It's like they're constantly reacting.
So allergies can keep them enlarged. Interesting. Is there anything else?
Yeah, there's also a genetic factor. Some kids just seem more prone to having larger adenoids, maybe because it runs in the family. If there's a family history of enlarged adenoids or maybe lots of ear infections, the child might have a higher chance of developing the same issues. It's usually not just one thing, though. Often, it's a mix of these factors working together.
It makes sense, the combination. So, okay, we know why they might get bigger. But for parents listening, the really crucial part is knowing what to look for. What are those telltale signs?
Absolutely. This is where parents being observant is so, so important. The signs aren't always super dramatic, but they can really impact a child's life. Probably the most common sign is breathing difficulties, especially trouble breathing through the nose. You might notice your child breathing through their mouth a lot, almost habitually.
Mouth breathing. Okay. Especially at night, maybe.
Yes, definitely noticeable at night, but often during the day too. If a child constantly has their mouth open, that's a big clue. And this isn't just, a minor habit. Chronic mouth breathing can actually affect how their face develops over time.
Wow. Okay. That's significant. What else?
Snoring, that's another really common one. Now look, lots of kids snore occasionally, but we're talking about persistent, loud snoring. Or snoring that sounds like they're struggling maybe with gasps or pauses in breathing.
Pauses, like sleep apnea.
Exactly. That could be a sign of obstructive sleep apnea, where the enlarged adenoids are actually blocking the airway during sleep. And that seriously messes with sleep quality, leads to tiredness, irritability, even problems focusing at school. It's not something to ignore.
Definitely not. Okay, breathing, snoring. What about ears? You mentioned they're near the throat.
Yes, great point. The adenoids sit right near the opening of the eustachian tubes. Those are the little tubes that connect the middle ear to the back of the throat and equalize pressure. So when the adenoids swell up, they can physically block those tubes. And when the tubes are blocked, fluid can build up in the middle ear, leading to frequent ear infections or that feeling of fullness or glue ear.
Right, which can be so miserable for kids.
Totally miserable, and it can affect their hearing too, which obviously has knock-on effects for speech and learning.
And speaking of speech, does it affect their voice?
It often does. You might notice a nasal quality to their speech, like they always sound like they have a stuffy nose, even when they don't seem to have a cold. People sometimes call it adenoidal speech. It happens because the enlarged adenoids are blocking airflow through the nose, changing how their voice resonates. So yeah, if you're noticing that cluster, mouth breathing, snoring, ear issues, that nasal voice, it's definitely time to get it checked out.
Okay, that's a really clear set of warning signs. So, say a parent notices these things. What happens next? How do doctors figure out if it really is enlarged adenoids?
It's good for parents to know the process isn't scary. It usually starts with a physical examination. The pediatrician or maybe an ENT specialist, that's ear, nose, and throat, will have a good look. They'll check for that mouth breathing, listen to their speech quality. They might also gently feel the neck for any swollen lymph nodes.
Just looking and listening. Is that enough to know for sure?
Often they'll need a clearer picture of the size. So common next step is an x-ray. It's usually an x-ray of the side of the neck area called the nasopharynx. It gives a really good view of how big the adenoids are and how much space they're taking up in the airway.
An X-ray makes sense for seeing the size. What if they suspect allergies or infections are playing a big role?
Good question. They might do blood tests. These can help identify specific allergens if allergies seem likely, or look for signs of ongoing infection or inflammation. And crucially, if there have been ear problems or concerns about speech, they'll almost certainly recommend an audiometry test.
A hearing test.
Yep, a proper hearing test to see if there's any hearing loss because of fluid in the ears or those chronic infections. It's really important to catch that. So once they have all that information, the exam, the x-ray, maybe blood tests, hearing tests, they can make a clear diagnosis.
Okay. And then comes the treatment part. I think a lot of parents hear enlarged adenoids and immediately worry about surgery. Is that always the case?
No, definitely not. That's a really important point. Treatment is on a spectrum, and it really depends on how severe the symptoms are and how much they're impacting the child. For milder cases, where the adenoids are a bit enlarged but aren't causing major problems, the approach might just be watchful waiting.
Just keeping an eye on things.
Exactly. Monitor the symptoms, see if things improve on their own, especially as the child gets older. Sometimes kids do grow out of it as their airways get bigger. If symptoms are more bothersome, though, but maybe not severe enough for surgery, medication can be really helpful.
Like what kind of medication?
Well, if allergies are a factor, antihistamines can help reduce that allergic inflammation. Nasal saline sprays or rinses can help clear congestion, and sometimes doctors prescribe nasal corticosteroid sprays. These work directly on the adenoid tissue to reduce swelling and inflammation. They can often provide significant relief from things like nasal blockage.
So medication is a real option to manage symptoms. When does surgery, the adenoidectomy, come into play?
Surgery, the adenoidectomy, which is the removal of the adenoids, is usually considered when the problems are severe and persistent. We're talking about things like confirmed sleep apnea, those really frequent debilitating ear infections that are affecting hearing despite other treatments, or significant constant breathing problems that impact quality of life. When the enlarged adenoids are causing major disruptions that medication or watchful waiting haven't solved.
So it's more of a last resort, but effective when needed.
Exactly. The article highlights it's highly effective when it is necessary. It can make a huge difference for those kids. But the key takeaway is always consult with your doctor. Get that accurate diagnosis, discuss all the options, and make a plan tailored to your child.
That's really reassuring. Okay, we've covered symptoms, diagnosis, treatment. What about prevention? Is there anything parents can do proactively to try and avoid these issues or at least catch them early?
Yes, absolutely. Being proactive is key. The article gives some excellent advice here. First up, regular checkups. Don't skip those well-child visits. They're not just for shots. Your pediatrician is monitoring growth, development, and looking for subtle signs of issues like breathing problems or ear fluid. This is especially important if your child seems prone to lots of colds or respiratory infections. Early detection makes a difference.
Makes sense. Stay connected with the pediatrician. What about those triggers we talked about, like allergies?
Right. The second point is allergen avoidance. If you know your child has allergies, or even if you just suspect it, try to minimize their exposure to triggers. That might mean allergy-proofing the bedroom dust mite covers, maybe an air purifier, keeping pets out of the bedroom, paying attention to pollen counts during allergy season. Reducing that chronic allergic inflammation can really help prevent the adenoids from staying enlarged.
So managing the environment. That seems doable. Anything else?
Yes. The third thing is optimal nutrition. It sounds basic, but a healthy, balanced diet really does boost the immune system. A stronger immune system means the body is better equipped to fight off infections efficiently. And fewer, less severe infections mean less repeated inflammation of the adenoids. It all connects.
It really does show how these different aspects of health are linked, doesn't it? So bringing this all together, what's the main message you think parents should take away from our conversation today?
I think the core message is really about knowledge being power, understanding what adenoids are, why they might cause problems, what signs to look for. It takes away a lot of the anxiety. It means you can spot potential issues early, have informed conversations with your doctor, and feel confident in the management plan. It's about being an active, informed partner in your child's healthcare, realizing that even though these things can happen, there are clear steps and effective solutions.
Yeah, absolutely. It's about shifting from maybe worry or uncertainty to feeling equipped, knowing that while enlarged adenoids can seem like a big deal, they're usually very treatable. The goal is making sure your child can breathe easily, sleep well, hear properly, and just thrive without this holding them back. We really hope this discussion about enlarged adenoids has been helpful, giving you some valuable insights, and maybe made you feel a bit more prepared. For more detailed information on this and other pediatric health topics, or if you'd like to book an appointment or learn about their services, they offer a lot, like lactation support, acute and preventive care, immunizations, even medical ear piercings, and sports physicals. Definitely visit omegapediatrics.com. They work with a wide range of insurance plans and have locations across Georgia, which makes accessing their care pretty convenient for families in the area. Again, you can find all those details and much more right over at omegapediatrics.com.
And hey, if you found this chat useful, we'd really appreciate it if you could take a second to like this video. And subscribe to our channel too. We dive into important topics like this regularly. Oh, and share this video. Share it with other parents, caregivers, anyone you think might find this information helpful.
From all of us here at Have More Babies, thank you so much for tuning in and learning with us today.
We look forward to exploring another topic together soon.
Goodbye for now.